Good morning, good afternoon, and good evening, everyone, from wherever you're joining us, and welcome to today's webinar titled Patient Voices Matter, Transforming Industry-Sponsored Real-World Evidence with Patient-Centric Approaches. The panelists today will address integrating patient-centered research into real-world studies, focusing on diversity, equity, and inclusion, and developing systemic approaches for a more equitable research ecosystem. I'm Sydney Otemenchek from the events team at Scientist.com, and I'm happy to be your host for today. I'd like to thank the sponsor of today's event as well, Carillon Research, for making it all possible. I'd now like to take this moment to introduce our speakers for today's session. First up, we have Dr. Sarah Doherty, Principal Scientist of Patient-Centered Research at Carillon Research. Next up, we have Dr. Rebecca Engove, Executive Vice President of Research and Evaluation and Director of the Patient Insight Institute at the Patient Advocate Foundation. Our third and final speaker with us is Dr. Arthi Patel, Group Director of Scientific Partnerships and Population Research with Johnson & Johnson Innovative Medicines. And now, without further delay, I'm pleased to welcome our first speaker, Sarah, to join me and take it away.
Thank you so much, Sydney. Hello, everybody. Thank you so much for joining us for this webinar. And I wanted to echo Sydney's comments to thank Carillon Research, the sponsor of this webinar, to give us an opportunity to discuss patient-centered research in the context of industry-sponsored studies. We recognize that there are key stakeholders in this space from a variety of different perspectives, and we wanted to make an effort to recognize those stakeholders and their perspectives in this conversation today. So we have four parts to our agenda. Our first three parts will be our various speakers. I will start with patient-centered research background and context, sort of the what and how of patient-centered research. And I'll also talk a little bit about our journey as an organization as we continue to grow in our patient-centered research capabilities. Then I'll pass it over to Arthi, who will talk about the industry perspective and her journey in her organization as they work to integrate patient-centered research. And then finally, Rebecca, from the patient advocacy perspective, will talk a little bit about some of the operational challenges with a focus on finding the right patient. And then, of course, the fourth part will be our Q&A. So this is our speaker disclosures. Any comments stated herein are the opinions of the authors and speakers. Our webinar goals are to consider facilitators and challenges to integrating patient-centered research into industry-sponsored real-world studies. And I would say that we recognize that there are a couple of buckets that these facilitators and challenges fall into that might be unique to industry-sponsored studies. First, I think, is around the idea of organizational readiness, and the second is around operational challenges. The second webinar goal is to provide examples showcasing the application of patient-centered research with a focus on health equity. And the third is to discuss solutions for how to bring a more systemic, DEI-focused and integrated approach to patient-centered research in industry-sponsored studies. So for those of you that are not familiar with Carillon Research, we are a wholly owned, independently operating subsidiary of Elevance Health. And as a research institution, we partner with life science organizations, government agencies, and academic partners to generate real-world evidence to try and inform healthcare decisions and improve health outcomes. We can conduct a variety of different studies on the operational research side. Both prospective and retrospective research studies can be conducted leveraging our large data ecosystem called the HERD. And this is primarily done with our health, economic, and outcomes research and safety and epidemiology colleagues. We also have a clinical research department that conducts interventional research. So looking at this diagram, you can see that as a patient-centered research team, we have a variety of settings, constraints, and desires to implement patient-centered research across the full landscape of clients. So that leads us into the patient-centered research definition. And I borrowed this from the National Health Council's website. I've also seen it presented at various ISPOR conferences. I wanted to just focus on the last line, doing things with, not for or to patients, because I think this really emphasizes a bit of a shift in our thinking, moving away from patients as subjects and thinking more about them as patients as partners or advisors with expertise in their lived experience that then can inform and guide the decisions that we make around the conceptualization, the design, the conduct, and the dissemination of the work that we're involved in. So I pulled in this cartoon. I love this cartoon. It was put together by the Drug Information Association in collaboration with the Tufts Center for Study for Drug Development and a working group that they had assembled. And we have handouts. I don't know if you've noticed, and all the references from the slides are there. So if you're interested in digging deeper into some of the references that we have here, I'd encourage you to look in that space. I just wanted to highlight a couple of things about this particular cartoon. First, what I love about it is that it identifies that you can actually do patient-centered research across the entire life cycle of medical products by engaging patients at various time points across this cycle. Second, the cartoonist actually places us on the patient island, which I think is a really important perspective for all of us to have, which is to state that either in the past, currently, or in the future, we will all have unmet patient needs. And then the third point, which I'm not sure you can see, but there are different bridges. And on the bridges, there are individuals running in two different directions. Patients from the patient island out to the research group, and the people from the research group coming to the patient island. And this concept of bidirectionality is a key principle of patient-centered research and a hallmark of high-quality engagement. So adoption of patient-centered research strategies is growing across industry studies, and I just pulled two references to demonstrate this point. The first was a survey of almost 1,000 med tech industry individuals, and they responded about 60% agreed that incorporating patient perspectives into the lifecycle management process is important or highly important, with about 88% reporting they're either involved in piloting, early, ongoing, or full implementation. And then a second international survey, it was just published this past year, of 710 corresponding authors of pragmatic clinical trials. A little less than half reported public or patient partner engagement. And among those who didn't report any engagement, the reasons for no engagement included, these were the top reasons: lack of requirements, lack of relevance, lack of funds, and insufficient knowledge. So I think what this information says is that definitively there is interest in patient-centered research and the interest is growing. However, we see that there are additional considerations and or barriers that need to be addressed before we can fully scale patient engagement. So this slide is intended to make a couple of points. First, there are a variety of different methods you can use to conduct patient-centered research, and that is represented on this continuum here. I have an arrow at the top, investment of time and resources, moving from left to right. And on the far left side, I have characteristics of engagement. And I think one of the important points to take away from this particular slide, and something that I think we're all struggling with, is how do we right size the approach to patient engagement for the particular project that you might be engaged in. And I would say that what should drive that decision are the goals of the project and, of course, the constraints. So for instance, if you want to conduct a retrospective cohort study using an administrative claims database on a small budget and a short timeline, at the least, I would hope that you would consider informing yourselves of the patient experience by using secondary sources. So you could look at patient advocacy websites where they might have information on the patient journey, static webcasts like The Voice of the Patient offered by the FDA, or social media content where you could do some social media listening, and that allows you to organically see where patients are going to talk about their priorities, their preferences, and their needs. And that information then could be used to inform and guide the decisions that you make with regard to your study outcomes and the comparators and the kinds of questions that you're asking. If your goal is to enhance the diversity and inclusion of your particular study, then you may want to lead farther to the right in the collaborative or co-leading space where you're working with community influencers or leaders who can help you identify non-traditional mechanisms for outreach or dissemination, and can also help you potentially tailor your intervention and or conduct of your study to be more appropriate for the community you intend to reach. There are a variety of different benefits that have been discussed in the literature to incorporating patient-centered research studies. And I actually borrowed this from the playbook for patient engagement in the med tech space done by Alera Health. And what I really liked about what they did was they separated it into 3 different domains. So the research benefits have been well documented in the literature. So engagement of patients often leads to more feasible interventions, improved recruitment and retention, fewer costly protocols or revisions, and improved data quality. But what I also liked is that they acknowledge that there are other domains that we should be considering with regard to benefit, including the patient and the industry domains. And I think that leads us to a consideration that I recently read about and heard about at a conference, which is the term return on engagement. So often industry sponsors talk about the need to evaluate return on investment, so the financial or operational impact that the company has been realizing as a result of a particular initiative. In this case, it would be utilizing patient-centered initiatives. And what I liked about this Michael's article was the idea that when we talk about patient-centered research, we really should be talking about the return on engagement, which includes both the return on investment, but also the impact on the patient and or community that's being engaged. So this particular article, I thought it was really interesting and wanted to share it with you. They approached industry sponsors who were utilizing patient-centered initiatives, and they asked them to rank on a 3-point scale: cost, effort, and impact. And the top 4 I've cut and pasted here for you to see. And I think it's important to make a couple of points. First, what's interesting is that if you look at the list here, these individual initiatives actually span the continuum that I showed you of methods of engagement. And that brings me to my second point, which is I would like to try and dispel the myth that I often hear, which is we can't do patient-centered research because it takes too much time or is too expensive. And you can see here that even something ranked by industry sponsors themselves who have implemented it, that something like a patient advisory panel, which falls to the right side of that engagement metric, is less expensive perhaps and requires less effort with a really high return in terms of the impact. So just want you to think about a variety of different ways that you might be able to implement some patient-centered strategies to make your work more patient-centered. Okay, so let me talk a little bit about some of the factors that we think might be influencing the integration of patient-centered research. As I mentioned earlier, I think it falls into 2 areas. The first is organizational readiness, and the second is operational considerations. RT and I will both be referring to our experience or our journeys within our respective organizations and some of the facilitators and factors that we think played an important role in our continued readiness as we both evolve and think about integrating patient-centered research. And then Rebecca, as I mentioned, will be focusing more on the operational considerations. So the first place I'd like to start when we think about organizational readiness is cultural readiness. And so I would encourage you to think about your organization and your core value statements and think about how they may align or not align with the domains of patient-centeredness. So I thought we might just together go through this exercise. I browsed a few biopharmaceutical and med tech websites. I downloaded some of the common words that I saw mentioned in these core value statements, and then I juxtaposed it with the domains of patient-centeredness. And I wanted to make a couple of points here. First, it's really interesting to see where there is alignment, where both the industry and the concepts or domains of patient-centeredness want the same thing. So emphasis around innovation, timeliness, inclusivity, diversity, and representativeness. It's also interesting to think a little bit about where the tensions might be. So on the industry side, there is an emphasis on agility, efficiency, and nimbleness. And if you compare that to, say, patient partnership, as I was saying earlier, which again falls on the far end of that continuum, if done really well, would be done in a bi-directional way. And so we all know that as you include more partners in your decision-making process, it makes it a little bit harder to become efficient and nimble. So that's something that I think the organization will have to resolve. And then the third point I want to just acknowledge, this was Rebecca's point as the 3 of us were preparing for this presentation and we were talking through our slides. she made the important point that patient-centered research really can help operationalize the industry value statements. So when you look at something like accountable, what does it mean to be accountable? Well, it might mean that you are transparent about the work that you're doing, the research findings that you've published, and find a way to make that information accessible to those who ultimately are the end users of the work that we do. What does it mean to be customer focused or put patients first? Well, it might mean that you're evaluating outcomes that patients care about. And as I mentioned in the definition of patient-centered research, that means that you have put effort into validating and identifying what's really important to patients, and then incorporating that information in your selection or in your conceptualization of the questions and the research that you do. So I think this will be my last slide given the time. I want to make sure our other speakers have plenty of time to present their information. I just will briefly walk you through this evolving conceptual model, and I want to acknowledge my coworker, Julia Coleman, as she and I are working through a representation of our experience together, thinking about both how we can grow our patient-centered research capabilities, as well as diffuse the philosophy of patient-centeredness across our lines of business. So just to orient you, I have two circles here. The broader circle is the process, and the inner circle is the people or the personnel and the relationships that I think really helped facilitate the process. Starting with our leadership, I think, and this has been documented in the literature, supportive leadership is really essential. First, for having the vision to identify that patient-centered research is a distinguishing factor that really improves the quality of the research that we conduct. And secondly, has an influence in terms of the processes and the other approaches that might be integrated across different lines of business. So let me jump up to the process. So we started a year or so ago thinking through how we wanted to continue to grow our patient-centered research capabilities. And our first stop was with our staff. So we did qualitative interviews with senior leaders, frontline investigators, to learn a little bit more about their knowledge, their attitudes about patient-centered research, and their experience. We also wanted to identify case studies where patient-centered research was already happening across the various lines of business so that we could showcase those to the larger body of staff and say that this is already happening. This is what we mean by patient-centered research, and it serves as a model for the type of work that we want to continue to do. And the third thing that came out of the needs assessment is an identification of resources and infrastructure gaps, where we either needed to curate additional resources or address process gaps to try and further the integration of patient-centeredness. We then moved to our objectives and metrics, and I did intend for this to be cyclical, which is to say that every year, I think this is important to reconsider. So we have a set of objectives. We certainly at the beginning did send out an all-staff survey to benchmark our progress over the course of the year. We then moved into making sure that we were all operating under the same definition and had a set of guiding principles. So I can't emphasize enough the importance of ensuring organizationally that you have created a well-defined terminology that drives everybody towards a common purpose. We then identified ambassadors, and these are really important individuals who serve as links into our lines of business. These are people that either had expertise and experience in implementing PCR or interest. And this was another way that we could diffuse these ideas. They helped us curate different resources and also think through processes that we needed to standardize across the various lines of business. Last, we put together a mechanism for shared learning. So we had all staff brown bags, we had a speaker series, we have journal clubs, and we also, as a team, have established one-on-ones with our investigators. And this is just another way to continue to build those relationships, both internally and then looking at our wheel on the left side, our partnerships externally, making sure that those relationships are extended and established so that when we do have a need that arises, we can leverage those relationships when necessary. And the last part here, of course, is the importance of continued evaluation, both formative while you're doing the work and summative at the end, that can then lead you into your next year identifying what needs need to be addressed. And based on time, I'm going to skip my last slide And Arthi, pass it over to you.
Thanks so much, Sarah. So hi, everyone. Good morning. My name is Arthi Patel, and I'm pleased to be here today to share insights into the world of patient-centered research from an industry perspective. I will be speaking on behalf of my own personal experience working in the pharmaceutical industry. And through this discussion, I hope to provide insights into the importance of patient perspective from an industry lens, outline Johnson & Johnson's approach, discuss experiences and challenges of patient-centered research, and then end with an example. Before I go any further, I wanted to acknowledge our patient engagement leader, Lisa Shea, for her incredible leadership, for developing a robust plan, enabling the research teams to incorporate the patient voice into our work. Lisa, thank you. So patient-centered research is pivotal in understanding and addressing the needs of individuals and the communities we serve. As you can see from the slide, it includes various aspects. We at Johnson & Johnson have redefined our existing relationship with patients through the creation of a patient engagement model. This model involves a diverse group of individuals living with select conditions or acting as a care partner. They provide invaluable insights and feedback on a structured series of activities. So through this approach, it facilitates the early, systematic, and direct engagement across the product lifecycle. And by doing this, we are ensuring that our solutions are tailored to meet the needs of patients effectively. So you may be asking, but why is patient-centered research so important? And it's because of our commitment to patients through initiatives such as our Race to Health Equity. We recognize the importance of patient-centered, data-driven approaches. And so by incorporating real-world evidence and ensuring the patient perspective is woven into our approach, we can uncover the reasons behind the disparities and develop evidence solutions that address the context of patient care. In essence, patient-centered research is not just about the numbers, but it's about this understanding the stories behind the numbers. So how are we going about doing this? And so again, from my experiences, there are 4 key elements to our approach. The first is that we're implementing a model with a truly embedded cross-functional team. This means that patient-centered approaches are embedded. The second, and I can relate to a lot of the points that Sarah was mentioning, is about just the systematic approach and the embedded approach as well. And that we are proactively engaging with patients and sharing tools and processes across teams to ensure that systematic approaches to gathering and implementing patient insights. The third area is that we're holding ourselves accountable by measuring progress and ensuring we gather feedback directly from patients, and then using this input to drive change. And then the last area in an ever-present dynamic environment is that our approach is dynamic and that we're constantly working to address the evolving patient needs in new and innovative ways. So let's dig down a bit further in how are we going about this. So again, drawing from my experiences, I've identified these key areas of placing the patients at the forefront of research. The first is really around establishing and setting clear program objectives, whether it's a one-time engagement, such as an ad board, or a long-term relationship building. Building clarity in our objectives has ensured alignment and meaningful outcomes. Additionally, recognizing patients as an expert in their field really starts to underscore the importance of fair compensation for their invaluable contribution. And again, I can't thank Lisa Shea and her team enough for their hard work for establishing governances across teams to ensure that there's consistency and alignment. So for example, implementing SOPs as well as guidebooks helps to incorporate more uniformity across the different cross-functional teams. And I can speak on this just from as being a research lead and leveraging these different patient engagement strategies, is that having this governance and established processes lays down a foundation, and having that comfort level with your legal compliance, regulatory, and privacy partners to then figure out new opportunities for further engaging with patients. And this really leads to this next area, which is around early and frequent engagement with key partners from legal, compliance, regulatory, and privacy to ensure that we're staying within the guardrails. In addition to these key partners, building a champion base and leadership support for driving further commitment is essential. How to go about doing this, I can't emphasize the importance enough of the socialization aspect of it. And what I mean by this is once you hear the insights, what are we doing about it? What resonates internally with leadership? How are they incorporating these insights into the research? Because again, if the insights are sitting on the shelf somewhere, it's going to collect dust, but there's not going to be actions that are taken. And this is also really key in terms of driving impact, securing additional funding, as well as the long-term success. And just as important as it is to be used internally, we also need to communicate back to the patients through a feedback loop. And so to do this, it's important to build trust and community with the patients, let them know their voices are heard, but then also what are we doing with the insights and sharing that back with them. And then the last piece on this slide is around the DEI perspective of really ensuring our research and our efforts are inclusive and reflective in the diverse patient populations. So this leads to some of the navigation challenges. Whenever patients are involved, as we all know, privacy considerations must be carefully addressed. And so again, emphasizing the early partnering and ongoing partnership with your legal, privacy, regulatory, and compliance colleagues is essential. One of the ways that we have worked through some of these considerations is framing the patient more as a consultant and following best practices that PCORI has really leveraged to really further strengthen our privacy considerations. And then the other piece too is around the time. I know Sarah touched on this as well, and I know Rebecca will as well. But I would say it's more of the upfront piece, in terms of investment and buy-in, establishing processes and legal and HCC concerns. But again, once you have that framework established and it's baked into your plan, you'll actually find that you'll identify more efficiencies in the long term. And that's really what I wanted to provide you as an example on my next slide, which is an example. So I thought it would help to provide an example to, again, illustrate how patient-centered research has been incorporated in some of our work. So we conducted a mixed method study in collaboration with the health system to uncover barriers to IBD care, particularly focusing on historically marginalized patients. And so by actively engaging with diverse patient advisors that reflected our study population through our survey, development, interpretation, as well as dissemination, we gained invaluable insights into the challenges these patients faced. Our collaborative approach was critical in developing the survey and really helped us kind of make sure we capture the experiences and their perspectives. So that would help to give you a couple of examples. So one is we held a series of 3 virtual focus groups with 15 patients prior to the finalization, in which we asked the patients to review the survey and then come ready to be prepared to talk through it during our sessions. And the amount of feedback we received was incredible. So examples include fine-tuning the language, including validated instruments that were developed 20 years ago to more recent times, as well as incorporating more patient-friendly language that also resonates in terms of social aspects as well. And overall, we've ended up making over 17 global changes into the survey. And we also incorporated additional changes into the clinician survey that complemented this patient-specific one. And then after we received the analysis from both the electronic health record and patient survey, we again reviewed the findings with the same patient advisors who informed the survey. And they validated the findings, but also again brought to life and really built the narrative through their experiences and concerns. So here's an example of a quote that we've included in the paper that starts to illustrate that, this one patient's response that was similar to the other sentiments in the focus groups. So I definitely agree with these findings. It's definitely heart-wrenching when you really think about it. I've dealt with it personally, especially when it comes to health-related quality of life. And I also have a brother who has a similar illness to mine, and we hear and we speak about it quite often because I have children and I'm concerned about their health as well. And I hope you can see just the illustration of this quote and how much more it gets than just kind of talking about just a health-related quality of life score. The findings also shed light onto areas that you would expect around access as well as financial difficulties. But again, during the conversations, these firsthand perspectives really started to illustrate the challenges. So for example, one of the patients reported they live in a rural area, so finding an IBD specialist was challenging, requiring her to drive several hours each way. In addition to those types of insights, we also uncovered unique findings on medication concerns that were reported in higher among Black and Latinx populations, specifically around greater worry about medication harm and addiction. When we initially received the findings, we were struggling with interpreting it just because the medications were not addictive in nature. But when we heard the patient's concerns around dependency and higher doses to get a response, it made sense, especially just given the progressive disease. And I think some of these patient insights also helped us advocate and show the insights or the importance of patient-centered research to our internal colleagues as well. So I'm going to just go to my last slide before I end. And I just wanted to leave you with the key message that providers have one perspective, patients have the other, and we really just need to listen. And their insights into the journey and the treatment decision-making inform our work, from shaping the study strategies to the protocols, as well as guiding external communication development. In addition, incorporating the perspective of patients is not just beneficial to us, but it's also a priority for the regulatory bodies like the FDA. So as we continue to embrace patient-centered research, not only enhances the quality of our work, but also contributes to the broader DEI initiatives as well. So thank you so much, and I'm going to hand it over to Rebecca.
Thank you so much, Arti. Excited to be here. So I am Rebecca Angove. I am the EVP of Research and Evaluation at Patient Advocate Foundation. I'm also the Executive Director of our Patient Insight Institute. And I just want to thank my fellow panelists for setting this up so nicely, really going through a lot of the scaffolding and theory and value around patient engagement and research. We set up the Patient Insight Institute really with patient engagement and integrating patients into care research and healthcare systems change really intentionally. A little bit about us, we are a direct service organization that provides services to over 180,000 chronically ill patients a year. And what we've learned over that work is that there is more work to do upstream, and that those voices of patients, those experiences and what they can bring to projects are really invaluable. And that's why we've set up the Patient Insight Institute to really provide space for researchers, for those in healthcare and policy work to come together and connect with patients and patients' communities to inform their projects. So excited to share a little bit about what we've learned through our work in this space. Here's some of our collaborators, and I put this up here just to show the diversity of those that we have worked with, everything from small community groups to large industry partners, and kind of everything in between, a lot of academic partners. So this work of engaging patients and caregivers is really gaining some traction in a lot of different spaces, which is wonderful to see. I want to expand a little bit on what was presented in the first presentation, and so this definition probably looks a little familiar. This is not the definition of patient-centered research. This is actually the definition of patient engagement in research. And while these definitions are similar, I just want to make a few distinctions. So when we say at the Patient Insight Institute, when we say patient engagement in research, this is what we mean. It's really bidirectional, active, meaningful, collaborative, and again, interaction between patients. And when we say patients, that's patients, caregivers, the patient community, across all stages of the research process. We really feel that you can't have patient-centered research without patient engagement. And so where we kind of fall, and you've seen this diagram earlier in this presentation, as in our panel as well, this is where the engagement really is on the right-hand side of this table. Now, the informed side of the table, there's very important information that can be pulled from secondary sources, from community listening. There's a lot there. And just like you can get a lot out of garnering insights and data from patients that are participating, say in qualitative aspects or components of a project. But those things are different from actual patient engagement, which falls on these last three boxes of the continuum. And one other thing that I wanted to go through, because there's a lot of confusion in the field here, is the difference between qualitative research and engagement in research. And while their tactics are often the same or very similar, they're actually two separate and distinct things. One is research, right? The participants are separate from the research team. There's IRB. You have to consent participants, or at least get a waiver of consent. Your goal is to really publish and disseminate kind of these findings to increase general knowledge. That is a qualitative component of a mixed methods project, or a standalone qualitative research project that can absolutely inform and answer questions like, what is important to patients? What is patients' experience in certain areas? But that's different than actually having patients as part of your research team. And that can be patient advisors, that can be patient partners, that can even be a survey or a listening session where you're still pulling in data and insights, but it's really to inform the decision making of the research team. So you're bringing that information as part of kind of that research brain trust and team, as opposed to collecting data in a research way. And so these are, again, apples and oranges, right? They're both fruit. There's a lot of overlap in the tactics, and they're confused a lot of times because that methodology, the goals of pulling in patient insights and some of the approaches used are very similar. But when we talk about patient engagement, we are talking about that systematic integration of patient voices into a research team for decision-making purposes. The other piece that I really wanted to address today was some of the practical barriers, and I know that there's 5 here. I'm going to speak to the about 3 on here, but there's been a lot of challenges noted. One of them is really around the time that it takes engagement, so those timelines. And something that we do is really have engagement embedded early on into the timelines and the planning. You can even quicken this by having the infrastructure built, or partnerships like the Patient Insight Institute, right? We extend capacity and function as the kind of built infrastructure to do this engagement. And if you have those ready, those partnerships or that infrastructure ready built, it's a lot easier to streamline that patient review, feedback, and integration into those research projects, as opposed to going, oh no, now we have to add this component and we haven't budgeted for time. Again, that can also help with finding the right patients, having those relationships already built, and also the in-house skill needed. You don't always need to have that. You can outsource it. You can find consultants groups like ours, other patient groups that really can be the experts in this engagement space, both the methodology, the strategy, the approach, can find the patients and can really add quality to the engagement that you're wanting to do with your research projects. So this gets to the idea of the right patients. And when I think about the right patients, I immediately go to health equity, DEI, all those words that are so buzzy. And what I like to think about is think about it in terms of reach, representation, and diversity. So it's great to have a single patient as a patient partner on your research team, but you're really only getting one voice from one patient and one experience. So the goal of having a lot of different engagement tactics is to get the full breadth of experiences, or as much as you can, and also find ways to drill down into the depth. And so regardless of the medium, regardless of the approaches, you really want to make sure that you're maximizing the amount of voices and perspectives you hear, so you're not reinforcing any bias that comes with having limited number of voices. And this really speaks to kind of who tends to be in our circles, right? We probably all of us have a few patients that we could call on to be part of these groups, but we tend to align ourselves and pull in people that look like us, think like us, and have similar backgrounds. And when you're thinking about the patients to bring in, again, reach, representation, really pulling in those that have a unique and different perspective. And this is important not only for issues of diversity and because it feels good, it's the responsible and ethical thing to do, but it can really improve your research. So I love this slide. This is one of my favorite slides in the world. This is science. It is citizen science. And on the left, you have squirrel observations in the St. Louis area. And on the right, you have the race and ethnicity breakdown of census tracts in the St. Louis area. So if you look at this, you can, and they had some community engagement where they had people go out and make squirrel observations. This was a environmental study. And so looking at this, you can, assume two things. There are no squirrels in the northern part of St. Louis, or that squirrels maybe only live around white populations, right? Because that's what we're looking at in the race ethnicity data. And what really happened is that this scientific group's engagement was not representative or diverse of the St. Louis area population. And so they have skewed data. There are squirrels in the northern part of St. Louis, so that is not this is not an accurate depiction on the left. But what it does show is that by only having a limited and not diverse group of community members involved, it actually skewed their data and their findings because how they were looking at the problem was biased. And so it's a very simple way to show not only is focusing on diversity, reach, and representativeness the right thing to do and the good thing to do, it's actually critical to quality, effective research. So it's going to improve your research projects. So we will have time for questions, but I do just want to share a little bit about what we do at the Patient Insight Institute. And it is unique in a sense, but there's also a lot of people out there that can help with this engagement. So the takeaway is that you don't have to do this alone. You don't have to try to be an expert in engagement. There are a lot of groups like ours that can help build your capacity to reach out to patients, that can coach scientific teams on the best approaches to engage patients and pull in those insights, that can build surveys, that can convene focus groups and listening sessions, that can capture kind of that early research data to inform your projects. And those are some of the things that we do. Specifically, we've done a couple projects to inform research methods, and going back to the previous panelists that really talked about this can be easy and not resource intensive. Here's a couple examples that we have that we did that were really high impact and low, kind of low cost, low in times and money. So we had a group that wanted to design a cardiology intervention, and they wanted to know if this intervention that they were designing before they even, put in the protocol for funding, they wanted to know if this was something that was going to be acceptable to their patients. And so we did a very quick survey that took total 7 days to develop, administer, and deploy and get results back. We had 400 patients that responded, and we really collected some great data on the acceptability of the intervention, the willingness of patients to participate in all these different arms, from the placebo to the different intervention arms, as well as some of the barriers that they're reporting. And this really helped the research team understand how to maximize the research protocol to ensure that they wrote it in a way that was going to reduce attrition and maximize their recruitment efforts. So this 7-day minimal fund investment actually saved them a lot of time and money in the long run because their recruitment was more efficient and they had less attrition. The last example I have, again, briefly, is just communication materials, right? This was a recruitment flyer, but you can think about all the brochures you're putting out, all the recruitment, all the messaging. The one on the left was what our researchers brought to a standing advisory group that we have. Pretty good, but I think our patients made it even better. Things like, under the contact us, you need to have somebody's name. Right? They advised on language, kind of the visuals used, got perceptions of the flyer, like what are you reading versus what the original developers of this flyer wanted to convey. And again, 20 people reviewed this. It was a 6-hour time commitment, and that included our coaching of the scientific team and minimal money investment and a really big impact. So at the end of the day, there's a lot of groups doing this work. I want to just use this forum to invite everybody to join us at Atlanta from April 8th to the 10th. We have our annual Patient Insight Congress, where we bring together a large group of patients, caregivers, researchers, industry, policymakers, coming together to really talk through things that are important in healthcare, but it's also an opportunity to meet some patients, to maybe understand what this engagement can and will look like. And it's really just a breath of fresh air. It's an event where the patients have their own table, and we bring everybody to that table, as opposed to cherry picking patients to bring to all the different scientific conferences. We try to bring everybody in where patients are centered there. So I hope that gave you some practical ideas for how to operationalize patient-centered research, specifically engaging patients. And I really, along with the rest of my panelists, appreciate the time and are excited to take some questions.
All right. Thank you, everyone, for your fantastic presentations. We are going to get started with our Q&A session in just a moment. I would just like to quickly ask that if you have to leave the webinar early, to take a moment to complete our survey and let us know your thoughts and feedback on today's webinar. We really appreciate it. Okay. Let's get started with our first question. In a multi-stakeholder advisory group, how do you balance lived experience and clinical expertise in decision-making if the various perspectives don't agree on the priorities?
So go ahead, Artie.
Okay. So I think just a couple of things that have really resonated. I think there's a little bit of a myth to some of that. I think a couple of things that kind of came through is when we were doing our patient focus group sessions only, there's a lot of hypotheticals. There are a lot of hypotheticals of how a doctor would respond based off of some of the past experiences. But what I've also seen is when you have both the patients and the providers coming together, they draw from each other's insights. And if there's also this level of respect and understandings, and they're feeding off of each other. And so I think just it helps build that community and also some of the insights that you wouldn't have otherwise, and also helps see the clinician's perspective and the patient's perspective. So it's just some examples that I've experienced.
Yeah, and we've experienced the same thing. One thing that we do is if we have concerns or we think that there's going to be some disagreement, we'll actually do kind of upfront rules or SOPs around what group you defer to for certain things. So for example, scientific methodology, great to get patient input, but probably want to defer to the scientists to really nail down that. Whereas some of the other pieces, we've definitely said, kind of the patient perspective needs to take priority and carry more weight. So there's also ways that you can put some structure around, what does a tiebreaker look like, or which group should we defer to for certain areas of the project. That has worked really well, because to Artie's point, it does kind of reinforce that mutual respect and the mutual expertise that everybody brings to the table and to the team.
And I think I would add, just reinforcing and echoing, Rebecca, what you just said, the importance of creating an engagement plan so that you can set those expectations ahead of the actual process and interactions. I think role expectations and ideas around governance and decision-making are really important for you to think through, as you said, ahead of the actual activity itself. That also helps reinforce the relationships that you probably want to maintain for future activities. If patient participants or partners know what to expect and how their feedback will be incorporated, they may be more likely to participate next time.
Okay, great. It was nice hearing from all three of you about that. Thank you. Let's jump to our next question here. What advice do you have on including vendors in PCR?
So, okay, so I can start. I think it helps to kind of bring them in at the beginning, or just even before the beginning, when you're kind of thinking through some of what your strategies are, because there's a lot of different approaches. And I think Rebecca and Sarah touched on this. There's a lot of time, quick solutions that you don't have to invest a significant amount of dollars, and then it could potentially also be some of your feasibility to then think about larger investments. But I think just early and as you're shaping the strategy would be a suggestion I would have. Leave it to Sarah and Rebecca to provide other insights.
I mean, I would agree, and I think Rebecca, you referenced this in your conversation. I think if you don't already have in-house the infrastructure, it may be a very efficient way of trying to do patient-centered research. It may also serve a second purpose, which would be to learn a little bit more about what goes into doing patient-centered research as you potentially are trying to launch your own efforts in-house.
Okay, great. Thank you so much for that explanation. Moving on, we're struggling to make a case for investing resources into patient-centered research. How do you connect the need for patient voices to business objectives?
So I guess I can start. I think the key is really being able to connect the dots for people internally around just the patient voices to the business objectives, and really highlighting some tangible examples. And I don't know about you all, but for me, I think I learn best when I have examples that I can resonate with. And so in the IBD example, provided some really important insights around non-adherence, because you think about the addictive piece, that was something that none of us were really thinking about. But then when we heard the patients, it really was like, oh, it was kind of like a light bulb moment for us. And I think some of that also helped us kind of share, because some of our internal colleagues were on the call and they heard it too. And then you have more surround sound advocacy around you to then build the case. And I think it also helps, it's not just, you have the patient quotes or just different testimonials that help illustrate some of those points, because, for all in the industry, non-adherence is always an issue, right? And so being able to connect some of those dots is going to help with the short term, but then also the long term, because you may not get some of those insights otherwise. So I would say there's no silver bullet, but I think the key is really starting, with connecting the dots, I would say.
Yeah, and Artie, you make a really good point too, because coming in and understanding why you want to engage patients and do patient-centered research is different than just wanting to do it because you want to check a box. And so really figuring out why you want to do it will help connect to that value, both in meeting kind of your organizational objectives, but also the examples I gave where you're really helping to make better science, better projects that you are going to save money and time in at the end of the day around recruitment, retention, adherence, right? All of these things that you are so important, right? And then you're also improving relationship with patients and community groups where they feel more trusting in science and they're more likely to participate. I mean, I think it just, it's a positive ripple effect, but having to kind of put your finger on some of those like ROI, if you will, pieces, I think are easy to do if you know why you want to engage patients in the first place.
I think one additional point, and this is just, as I had said earlier, thinking about all the different stakeholders that are in this space and really want to see scaling of patient engagement and the advancement of patient-centered research in general. I think we all have a responsibility to think about not only internally showcasing examples and convincing our peers and within our organization, but also externally publishing about our experiences, both lessons learned, challenges, and facilitators, because I think the more evidence that we have empirically that show the benefit, the better off we'll be. And one of the slides I didn't get to present was from that international survey I had mentioned earlier, and they did a comparison of individuals in the survey who said they had done engagement, and yet when they compared it to the actual trials that were published, they could only find 22% of those authors claiming that they had done it that actually described it in their manuscripts. So it's not enough just to do it, but I think it would help all of us connect the patient voices to the business objective by publishing about your experience.
All right, great answers. We are approaching top of the hour, so we'll definitely have time for one, maybe two more questions, but I just want to remind the audience to keep submitting your questions. They will all get sent to the speakers, and we should have a Q&A report for you in a couple of weeks' time sent out to everyone. So our next question, if you are engaging with patients, what is the risk that the relationship with the patient might in itself affect what the patient reports? For example, a more positive experience is reported.
So I can start on this one. I think it goes back to the slide that I presented on the difference between research and patient engagement. And so, for example, when you are engaging with patients, and that means bringing them into your research projects as advisors, as bringing their insights, their perspectives, anywhere across that continuum. Those are not going to be the same patients that you are going to recruit into your research project or study. And so, there may be, I can think of an example where there may be a little overlap, like if it's a survey project, but for the most part, that engagement with those patients are separate from and should be separate from your research participants. So there is not really a risk of that relationship kind of jading or shading any of the patient-reported outcomes or any of the data that you're pulling in. If anything, their influence around how you're collecting the PROs or how you are interpreting the data is actually going to improve that data collection and analysis. So it goes back to that slide of keeping these things very separate, that one is research, and those are research participants or subjects. I know we don't like that word, but it's easier to use in this case. And the other are those patients that you are engaging on your research team as advisors to influence and plan your research.
Okay, that was a very helpful explanation. Thank you. Yeah, we are out of time for today. I want to say thank you so much. We have still several really great questions. So I am going to pass those questions on to the three of you to hopefully have some time to answer, and everyone can get their answers to them a little later. So I just want to say thank you so much to the three of you for taking the time to present today. It was a pleasure having you, and I hope that you enjoyed yourselves.
Thank you.
Thank you so much.
Thank you so much.
All right, fantastic. In closing, we hope you enjoyed this HealthEconomics.com webinar sponsored by Carelon Research, and I hope you all have a great day.